You're listening to The Outcue, a 21 News journalist perspective on a top news story.
Good morning. It is Thursday, April 3rd. I am Assistant News Director Justin Mitchell, and we are back with this month's edition of The Outcue. When last we left you, we still had two functioning hospitals in Trumbull County run by a group called Insight. They had bought the hospitals, but not the buildings, from MPT/Steward Health, and they were up and running, and the day was saved. That is no longer the case. Since then, we have seen a rapid-fire series of events that has been a true team effort to keep on top of, particularly over the course of the last 2 weeks, where a round of layoffs became laying off or furloughing everybody, to insurance being canceled, to closure after closure after closure, and now total uncertainty for what the future means, and people telling us, including employees and county officials, that they're learning things from news reports and not from any of the officials involved. So two of the people who've been covering this, and I think almost everybody in the newsroom at this point has had a hand in this, are Sydney Canty and Leslie Huff. And because we can't fit the entire newsroom up here, we've got these two to help me fill in the blanks as best as we can. So I'm going to start with just, between the two of you, help me out here, because so much has happened over the past 2 weeks that it's hard to even remember where this all started. But about 2 weeks ago, we get wind that, because remember, there were some departments closed down. I think that's what happened first. Inpatient and outpatient were temporarily closed, and they were keeping the emergency room up and running, and Hillside Rehabilitation Center was untouched, and the satellite offices were untouched. Take it from there. What happens next? Either one of you can jump in.
Well, I think you start with maybe the furloughs shortly after that.
So I jumped into this sometime last week.
I think you both had to jump in on day one here with or maybe it was day 1 and 2. This all kind of goes like a blur.
Mm-hmm. Well, I can talk about how the emergency room closed. That's when
Yes, that's the next thing that happened. So that's what I mean, is like the next event, I believe, was because they insisted, please make it clear the emergency room is open. We still have patients. We're still running an emergency room. And that was a bad situation because that's all they were running, but they were running that.
Right.
So then, as I recall, you're in the middle of another story and I have to run down and find you and say, drop it, here's what just happened. So start there. Take me from there.
Actually, I'm out on another story.
And then
just happened to be coming back, and you're like, okay, the emergency room is on pause. And so I go over to the hospital, and basically the parking lot is bare at that point. I mean, people are coming out, but what's weird was there were also like ambulances coming and going throughout the day and dropping people off.
Yes.
So that's why it was kind of weird about what was going on, if there was anyone inside, how many patients were inside. And I couldn't really get a hold of anybody until I think right before maybe after my 5 o'clock live shot. And then that's when I was able to contact a switch control employee, and she kind of gave me the background about what's going on. So around, I think, 2 p.m. is when Insight sent out a message saying, we're closing the emergency room, or putting it on pause.
And even, well, it is important we get those words. Some of them have more significance than others. They use the word pause. We're trying to avoid using the word close, because even though it is closed right now, there's no guarantees that it's going to remain that way. So we're thinking, like, they say pause, and that's their corporate word. What's that mean for people? Well, they're shut down.
Yes.
Which doesn't mean permanently closed, but right now it's shut down. So we get a tip about this. Insight did not proactively put that out there. A tip came into the newsroom that then finally we were able to get a statement saying that this was happening at 3 o'clock that day. Mm-hmm. Right. So then you're waiting out there trying to talk to people.
Yes. And no one wants to talk, of course, because they don't know what's going to happen next. Of course, everything is closed, but you also want to make sure you have your job, still.
Right.
So I'm like, hey, do you want to talk to us? And they're like, just kind of. And so I understand that. But basically, we're just, I guess, trying to figure out why it closed or why Insight wanted to pause it. Gosh, I need to get that out of my brain.
No, I
that
mean, for
word.
our purposes here, those words are interchangeable. We're just making the
Yeah.
distinction in our coverage that we don't know that this is permanent. It is closed right now.
Yeah.
I mean, it's, like a store closes at night. They closed that night and they have not reopened.
Yes.
They may reopen. We don't know, which is another part of the problem that we'll get to in a bit.
Yes. So another thing is, like you mentioned earlier, people didn't know until we broke the news about it closing. So when I talked to the employee, she's like, I had no idea until I read your article. And so that's when it just kind of hit me like, wow, they're really not saying a single thing to these people.
Right.
And they have no idea what's coming next. And maybe Insight doesn't know either. They could also kind of
Right.
go
No,
with
that's
the
a good
flow.
point, because it is possible, because Insight has sort of loosely in their statements put this on the Steward bankruptcy, basically that they were in a transitional period,
Right.
that Steward had agreed to make some payments to them and during the transitional period, and that Steward's not making those anymore. And I know that that's what they say. But that's all I know. I mean, we don't know why Steward would still have been making payments after Insight had taken over. We don't know why there was no apparently contingency plan or promise, or maybe there was that was broken. We don't know what happened there. But what we do know is that the next day, I believe it's the next day, we find out, all right, it's not just the ER now. There's layoffs, lots of layoffs.
Right.
We don't have an exact figure. I had a tipster send me a document that laid out a certain number, and then that number got bigger. And I think by the end of that day, and I might be juxtaposing days at this point, it was all of the facilities. It was Insight Trumbull, it was Hillside, it was the satellite offices, all of them
Right.
shut down for the time being.
Yeah, and there were conversations to try and mitigate that as much as possible. That's kind of when I jumped into this. I went out there to try and see what was going on with negotiations.
Right, 'cause you were
between
speaking
the
to
unions.
unions.
Yes, right. Chrissy Lewis with the SEI union and Tom Connolly with the AFS-CME union, and they were going into Insight's location over at Trumbull Regional Medical Center and trying to speak with them about negotiating what's going to happen, the transition, making that smooth, how many people would be laid off, for how long, that kind of a thing. And I waited out there for hours to see what would come of that. And then Chrissy Lewis came out just a few minutes before my 5 o'clock live shot. And she came on and she told us that, she had learned that obviously there would be some furloughs, but she hadn't known at that moment how many. And that what they were talking about is making the transition as smooth as possible for the employees so that it won't be the chaotic mess that it is right now. Here we are now, a week and some change later, and nobody's been paid still. It's been 3 weeks they're going on that. They aren't getting the accrued vacation time pay for that either. Their health care has been snatched, and then what they paid into it is also not being given back to them. And then on top of that, this lawsuit now that's out there that is hundreds of different employees filed by one person with Hillside Rehabilitation Hospital against Insight are all saying now that Insight violated this Warren Act, which is it's basically where Insight is required to give these employees 60 days notice.
Right. Warren
before-
is a federal law. It's the Worker Adjustment and
Yes.
Retraining Notice. And they have since issued Warren notices, but they issued them well after these people were already gone. I had a source tell me that they thought that they may just not issue one at all because that's enforced by the federal government, which is in a mode of doing much less, not much more at the moment, and that the odds of them enforcing it were probably very, very slim. So then, Chrissy comes out, she talks to you live at 5 that day, and says that they should have a list and more of an idea of what departments are affected beginning the next day.
Right.
By the end of the next day, she said it was downright cruel because they were not giving this list. And by the way, now it's everybody.
Yes, absolutely. Yes. So that was a situation where she was saying that she was trying to keep everybody calm because all of her union people are reaching out to her saying, hey, what's going to happen? Obviously, they're waiting to see if they're going to have a job tomorrow or not. That's
Right.
a mess to deal with. And so she's waiting and she's calming these people down as much as she can. But she herself is trying to remain calm because she's also included in this. And it's just really become a mess. I don't believe that they got the list for days. I don't think it was just 24 hours. I believe it went longer than just that one day.
Yeah,
I remember being off, still texting you like, "Hey, this is what she's saying to me today."
Yeah.
So,
And then, insult to injury for these workers, as you mentioned, they also didn't make payroll.
right.
So nobody gets paid. They were told that they would likely be paid by Tuesday of this week. Now, I'm not sure if we've spoken to anybody about that today, but we know as of yesterday, nobody had been paid still. So Tuesday came and went. Their insurance was cut off. So they don't have health insurance. They're not getting paid. They don't currently have a job to go to, and they do not know what the future holds. We are hearing that there's maybe one person left in this building. Oh, and by the way, because so much is happening, also the same day as the furloughs, the new president of Insight Trumbull was a guy named Gray Gauntz, who resigned about 2 weeks into his tenure, actually less than 2 weeks into his tenure. And Jawad Shah, the founder of Insight, is named the new president of Insight, of Insight Trumbull, which one would think would mean that he was taking a very hands-on approach, and maybe he is, but here's the problem. We can't talk to him.
At all.
Won't return calls. There's one spokesperson for Insight who was there when they were CHS, was there when they were Steward, is still there now, who is responsive, generally speaking. But a lot of this stuff is going up to Insight Corporate. There's a guy named Dane Walling. If you're an astute viewer, you may remember his name because he was the mayor of Flint, Michigan at the time of their water crisis. And now he's a spokesperson for Insight. And there was a woman named Irina, whose last name escapes me. She will not give a cell phone number and has issued one statement and has refused to even acknowledge receipt of follow-up questions.
Speaking of refusals,
Yes.
there's Amina Smith that I reached out to today. I reached out to Insight to see if I could speak to Jawad Shah. And of course, they were telling me, well, you can't contact him. There's no phone number, but I can pass the information along. This is a secretary or something I'm speaking to Amina Smith, who is his medical assistant. So I was saying, okay, well then if there's no telephone, how are you going to pass the message along? And then they go, oh, well, we send it through their email. Oh, okay. Well, then can I just have the email? No, you can't have the email. So you're refusing to give it to me.
Right. And so none of this, and by the way, I mean, I can tell you some of my communications or attempts at communication with Walling and this Irina have been somewhat forceful. I mean, this is close to 700 employees and the health of an entire community. So a lack of responsiveness is really not acceptable. And I've been telling them as much, and they don't care. They're not replying to that. I mean, I guess I can't put myself in their head and say they don't care, but they have not prioritized answering those questions or even returning a call. Does not put any of these workers at ease, certainly.
And maybe I'm wondering too if that kind of goes back a little bit to what Leslie was saying about how maybe they just don't have the answers, but at the same time, you can pick up the phone and say, we don't know yet either.
Right.
You know, just to give them something. These people that are waiting, this is their lifeline.
When
That's
we've
what-
seen,
oh, go ahead.
yeah, no, go ahead. What were you going
That's
to say?
an employee that I interviewed a few days ago. That's exactly what she said. She's like, if they would have just come to us and have been transparent, you know, it would have been sad. We would have been, you know, not okay necessarily, but we would have understood because you are being communicative, you know, and making sure we know what's going on.
This seems like the type of, because, I mean, we've covered news a long time. When there's a major community-wide crisis, which I don't think anybody could dispute that this is, because while it's not, I don't know the definition of hospital or healthcare desert, but there are other, I mean, the Cleveland Clinic has some offices in Trumbull County. There's St. Joe's Mercy. There are other places on an individual basis that you can go. So I don't want to overplay the crisis, but for the population, there are more hospitals in some third world countries than there are in Trumbull County right now per capita. So it's not a good situation, particularly when you get into behavioral health, which Mercy Health is working to ramp up, and they have a new hospital that will be coming, but it's not there now. They were releasing psych patients or finding places for them to go the day they shut the ER down that we still don't have an answer what they did, you know, where they were able to find places for them. So definitely a bad situation. And what I was getting at is those are usually the kinds of community crisis where you'll see sometimes daily updates or emails or news conferences, even if it's to say, we don't have much to say today, but here's what we're working on, here's who we're speaking to, something. And we're getting none of that.
Yeah.
And not just from Insight. So now, and I'm jumping ahead a little bit because this has been a day-to-day thing for close to 2 weeks now. But we haven't heard much from our elected officials, which is what you were working on yesterday, Leslie, and I was working on it with you. There are still elected officials who have not publicly said anything about this. And the ones who have largely had to be prodded to do so. I mean, we've gotten some statements. We got a statement today from Representative Nick Santucci's office. I mean, I can quickly talk about the ones that I reached out to. You can talk about the ones that you reached out to. I know that I reached out to the governor's office, and I sent an email and I left a message, and I got no reply. Others are saying they're speaking to the governor about this situation, but there's been no public indication that he doesn't weigh in at all. I reached out to the U.S. senators. I called John Husted's office. I sent him an email. I called Bernie Moreno's office. I sent him an email. Husted's office, no response at all. Moreno's office responded almost immediately with a form email that clearly is designed for any email that comes in. Talked about how he is eager and ready to listen to constituents, never mentions Trumbull County, and clearly was just something that went out automatically. And that was the closest thing to a response. We got a response from Dave Joyce's office that initially contained a mistake in it, saying that they had learned that they intended on shutting these down. Now, that was later attributed to a mistake made by a staffer, so I'll give them the benefit of the doubt on that. But all of these people who represent this county, nothing until that day. Now, Leslie, you were trying to reach Warren's mayor, county commissioners,
And I did.
and Mike Ruley.
Right.
And so talk about that.
Yeah, so the mayor, when I called, the secretary said that he was in a meeting with Insight at that moment. And so I told her, can you make sure he gives me a call back? Hours go by, still nothing. I texted him and didn't get a response. And then, of course, I call back and say, hey, is he there? Can he talk to me? And the secretary says, oh, he has the message. He'll give you a call. And so at that point, it's like maybe 3 o'clock, pretty late in the day.
Right.
And I'm like, okay, highly doubt that he's gonna call me. But if you just met up with Insight, wouldn't you want to tell the people about what's going on?
Right.
And on top of that, city council members, it took a while for them to get back to me as well. I know Councilman Greathouse was the main one who answered the phone and kind of told me that we're just waiting to see if the administration wants to do anything and we can consider helping resolve the situation. And I texted and called like the list of council people, and I would say 2 got back to me. 2 of them not including Councilman Greathouse. And that's when I learned more about just they're looking into steward health and how they've impacted, how they created all of this basically, or a significant portion of it. I guess I won't blame the whole thing on them.
Well, we don't know. We know that's what Insight's saying, but if
Yeah.
Insight's only saying that through an occasional statement, we don't know who to believe.
Right. Yes. And so then when we go to the commissioners, they had their meeting, and then that's when I learned that they have been working, behind the scenes to make sure, or to, just to figure out what was going on. And I know Commissioner Bernard, he said that he was completely blindsided by this entire situation.
What Bernard said was, I'm learning about this from you guys, meaning
Yes.
the news,
Yeah.
because he wasn't getting
Denny
anything from
Malloy.
anybody. And Denny Malloy, yes.
That's where he was saying he learned about it from Denny.
Okay.
Yes. And so, because Denny has been also the main one who has contacted U.S. senators.
And he's, correct me if I'm wrong, he's not heard back from them either, correct?
That I don't know for
Okay.
sure. He didn't, yeah.
He hadn't as of when you were talking to him, but obviously it's been a little while.
Yeah.
Yeah.
And then moving on to Senator Sandra O'Brien.
Sandra O'Brien, yes.
I called her office. The secretary, receptionist, took a message and said, hey, can you send us an email also? So I sent her an email, and then I heard nothing back from her. Even today, still there's nothing in my email box.
And with Doug Franklin, he's the only one, and correct me if I'm wrong about this, he's the only one that has given any indication that he's been able to speak to anybody from Insight.
100%.
Nobody else has.
No.
So we're certainly not able to sit here and say, nah, he didn't really meet with them. I take the secretary at her word that he was, but did anything come out of it? And who's he getting a hold of? And shouldn't the others know how to get a hold of them also? And why is he not coming out at all? He wouldn't return calls the night of the layoffs. He hasn't returned calls since then. Now, he's the chief executive of a city that's just lost 2 hospitals. So, I mean, forgive me for thinking that public service requires a response there, and that it's quite frankly derelict of duty that he's not doing that.
It makes me wonder if the secretary not misspoke, but she shouldn't have told me, because it might have been under wraps or something that he didn't want people to know.
Well, that's important that we remember that also. It's entirely possible that when these people talk about how they're working diligently behind the scenes, that's true. But we're in the working for the public business just like they are. And if they're making progress, the public has a right to know. If they're not making progress, the public has a right to know. Why are they not? I say this because, again, having done news for a long time, it's not exactly that far bygone of an era where when these things happen, they crawl out of the woodwork to put their face on it and say that they're going to do everything they can for their community. And it crosses party lines. We used to see Tim Ryan stand next to Bill Johnson. We used to see Sherrod Brown stand next to Rob Portman or J.D. Vance. And we certainly saw the local leadership, and they would stand there as a delegation and talk about what they were doing. If the situation required them to talk tough, they'd talk tough. If it required delicacy, they were delicate. But they were there. This seems like an outlier here.
Makes you wonder,
right,
what's going on. I mean, are they benefiting in some way? I mean, I don't know. I'm not speculating, but
I
I'm
don't
just
see
saying,
how they could benefit. I think it's more like, I don't know. The community gets a sense of apathy, and I don't know that that's true, but it's a bad look, especially when Insight was hailed as this savior coming in.
Right.
Denny Malloy in particular sang their praises a lot. He practically credited himself with helping to save the hospital. And, a former commissioner was on our air challenging them if this is the way we're going to go, because concerns had been raised about Insight. I mean, we had covered that they had some success, some failure, and that they were beholden to MPT owning their lease. So this is perilous is all. There was a potential for peril. And so the former commissioner said, that if this is the way it's going to go, I challenge them to remain open, do whatever it takes. Of course, that didn't happen. They are closed now, and nobody seems to want to answer to that. Denny Malloy's speaking, but he doesn't know what happened. But he certainly was willing to put all of his eggs in their basket going in. So it's not, if you're going to make yourself public for the good news, where are you during the bad news?
Yeah. And, go ahead. I'm sorry.
You got it.
Okay. So, Mike Ruley, I also contacted him. He sent a response, a statement saying that he's willing to work with local officials to, keep the hospital open, basically. So what I found was that he texted, the president of the SEIU.
Yes, Chrissy Lewis.
She has been trying to reach out to elected officials. Specifically, she reached out to Michael Ruley, and he responded to her text and said, "You're not in my county." And so I thought that was interesting.
Wow.
And so that was it.
Yes.
And so that just made me realize, wow, it's obviously we know that it's important to hold, people in power accountable, but it's like that was just a glaring example, because he tells us he's willing to work with local officials, but then he tells her, "You're not in my county. This has,
And just to be clear, why we were reaching out to Ruley, because he's correct. It's not, that is outside of his district. The actual main hospitals are, but there are satellite offices that are in his district.
Right.
And when you have a hospital shortage, you have a regional problem. So no, we weren't going to reach out to every state rep that doesn't have this district, but we did go at the federal level to these Congress people, the one whose district it is and the one adjacent, and that's why. So yeah, there was, if Chrissy Lewis's communication with Mike Ruley is to be believed, it was different than what we got. We got a statement professing a willingness to work, and the dismissal she's saying she got from him.
And calling this like a regional issue kind of brings me back to how you said you reached out to Governor DeWine and just didn't hear anything. Like, I wonder even what you make of that although he's not like here on the local level, he is still, like this, all of Ohio, I feel like is his jurisdiction because he's the governor.
Right. And so you're asking what I make of it. I don't know what I make of it other than it strikes me as unusual because it, again, does seem like the type of issue that would get, I'm not saying I expect the governor to roll in and call a news conference, although he has called them for much less. But I do expect some response, at least a statement. Now, I will say that at least a couple of the statements that we did get referenced having discussed this situation with the governor. So I don't have a reason to believe he's unaware of it, but I don't know if that makes it better or worse that he's not weighing in. But there are, again, close to 700 employees and the entirety of the population that have fewer places to go now. And some of this is specialty care that it's not as simple. Like we mentioned, behavioral health, that's already at a premium. And the rehab hospital is a specialized thing, as well as the fact that if you've got one hospital in Trumbull County, sure, they're going to do everything that they can, but simple math would indicate that if they suddenly have a doubling of their influx of patients, it's going to put a strain on resources. That's not a knock on them. That's just, you're doing double the work with the same amount of people. So yeah, it's going to be tough.
Yeah. And, even as of Wednesday afternoon, I still reaching out to Tom Connolly, the AFS CME guy, and he said that they still hadn't been paid. So we don't know. He says he caught this today or Wednesday very depressing. He called the whole situation depressing, and that they're still waiting to hear from the top, that they don't know exactly what's going to happen here. And so it's just, this is unlike anything I think I've ever reported on. I've never seen anything like this where everybody's fired for now, because of the 6-month thing. We don't know what's going to happen with that.
That's another thing that we forgot to mention, though, is that we're talking about all of these union employees furloughed. There was then a firing of upper management. And that happened in the middle of all of this, too, that there's a layer of upper management that, Leslie, you learned while covering the latest updates. Listen, I mean, I think it was coming from Tom Connolly.
Yes.
All I know is that, what?
Yeah, so basically Tom says, he calls me and says they just fired all of the senior staff for the nursing department. The security went to them and walked them straight out the building. And so they had no idea this was coming. They didn't get a notice. They just said, pack your stuff, you're out of here, So it came to a shock.
And increasingly, we've had employees that have been willing to speak anonymously to us, on camera with voices disguised, that kind of thing. And that seems to be starting to change now, because we did a story this week in which there was a nurse who just said, yeah, talk on camera. Like they feel like there's a sense that it's changing and there's more despair than there might have been. Tom Connolly is, I've talked to Tom Connolly about a lot of different hospital stories, many of them bad over the years. Tom Connolly was the guy to talk to when Northside Hospital closed. He's been around a long time. He's been very optimistic about the Insight situation until late last week, maybe, when he said that he was not optimistic and he was rapidly losing hope that there would be a good resolution to this.
I would say when the emergency room closed is when he became a little bit more like...
A little bit, but he got to the point of total despair after that. He was still holding out some hope by the ER.
Well, I don't know, because he brought up the legal matter and said, I'm not, we're not afraid to take this into the law.
So now, Sydney, today, because you meant that you created a segue there, and you mentioned this a little bit earlier. Now we've got this class action lawsuit filed. One employee's name on it right now, but they're filing it on behalf of anyone so situated, meaning any Insight employee can join this, saying that these furloughs or layoffs or firings, whatever they turn out to be, came out of nowhere, did not follow their collective bargaining agreement, were done illegally, and they are suing Insight, the Insight Foundation, Insight Trumbull, Insight Hillside, and another foundation out of Michigan that, quite frankly, I'd never heard of before, but is also associated with Insight. So tell me what you've learned today.
After reading through all of it, everything that you just named are obviously the reasons that they are filing. I'll go back over a little bit of that again, the 3 weeks that they haven't been paid. So they worked all that time and didn't get paid. So they're saying that's illegal, first of all, to not pay them that money. Then the not getting the accrued vacation time. And then there was the getting their health care snatched and then not allowing them to get the contributions that they made into that back, and then also violating the WARN Act. So all of these things are why they are coming, back after Inside, almost like we're standing up for ourselves against you and what you've done to us, and we're calling you to be accountable for this because now our lives are turned upside down. And what they're asking for is for all of those things back, as well as legal fees. Also,
Yes.
like they want all of that paid for. And they just kind of want this to go away as best as they can make it go away, meaning having that money that's owed to them and healthcare and, of course, the legal fees and everything. So this is, I've been trying to talk to Tom Connolly today, as well as Chrissy, to just kind of see where they stand with this. Tom said that he wasn't super familiar with the lawsuit yet, that he was going to be talking to somebody about it later on today to hear a little bit more about this and get involved. Because like you said, the so situated people, there are people that are affected by this that haven't joined it yet, but
Right.
still can, and
But it was
probably
just
will.
filed yesterday.
Yes, it was just filed. Yes, so they're still trying to, read it through and everything, and just try to get back some of what was taken from them.
And underlying all of this, just to re-explain a little bit, because this is important, and then we can wrap up here, is that Insight was sort of the hand-chosen operator to take over as a part of the Steward bankruptcy.
Mm-hmm.
They come with really not much cash. They had to ask the community to come up with money.
Mm-hmm.
They are still, I believe they took money from MPT also, sort of a loan from MPT. So they are in a precarious situation because they're taking over a troubled asset that is still the brick and mortar owned by the same landlord that Steward blamed for their bankruptcy, saying that the terms of the lease kept changing and becoming less and less tenable.
Mm-hmm.
That's a more complicated situation than that we do not have time to get into, other than to say that there's no reason to think that Steward was the innocent victim there either.
Mm-hmm.
Both have factors that play in. But beholden to MPT, and apparently still somewhat beholden to Steward. And so whether they were doing right or wrong, the rug was able to be snatched from under them. And I point that out because in the backdrop of all of this is that we have another regional hospital that has a hiring fair, or that just had a hiring fair yesterday and is trying to ramp back up, which is Sharon Regional. Mm-hmm. They, same situation, an upstart company taking them over, Tenor Health, even newer than Insight. No, this is the first hospital they've ever taken over, and the last one they tried to run, the only one they ever tried to run, was closed within 4 months. And they had no money. They needed the community to kick in $11 million, or I'm sorry, $20 million. And there's no way of knowing how firm the ground they're standing on is. If this could happen with Insight, could this happen with Tenor?
Right.
This is happening all over the country with these private equity hospitals. We've spoken to a woman named Mo Tosic who writes for the American Prospect and has chronicled this all over the country. And there is a sense of pessimism about this, not because they're rooting for failure, but because realistically, the deck is stacked against a lot of these upstart organizations. Mm-hmm. Final thoughts from either of you on where this could be headed, what the people you're talking to want from them, anything you'd like to add?
My question is, why is it so hard for these hospitals to become nonprofit hospitals like Mercy?
Right. I don't know that.
Okay.
But I do know that it's hard to profit as a hospital in a lot of places, particularly in places like the Mahoning Valley, in part, and it's only in part because obviously every situation has unique factors of their own, but a big factor for any hospital is that Medicare and Medicaid do not reimburse at a high rate. And so if you are running a hospital in an area that has an aging population or a low income population or both, like the Mahoning Valley, then most of your revenue is coming from Medicare and Medicaid, which means you're not getting reciprocal revenue for the services that you're providing. And that is always going to be a problem for any hospital operator. Some systems have managed that. Mercy Health manages that. Now, whether it makes a difference, profit or nonprofit, I'm not sure. You know, Tenor and Insight have both, they've started foundations and expressed that they would be nonprofits. So we'll see. But even when you're a nonprofit, that doesn't mean you don't need to pay the bills. You know, so there's
or
still,
the people.
you got to keep the lights on. And it'd be a tough situation for the best operator. And when I say the best, I mean the most experienced and with the most resources. And Insight and Tenor are not that. These are not disputable facts.
Yeah.
So I don't know where it heads from here.
It'll be interesting to see where this lawsuit goes.
That's what I was gonna say.
I mean, are they getting paid? People think that they're never going to get paid. Some employees who I've spoken with, so they think it'll just.
I feel like there's no way that can happen, though. If you did the work and there are laws out there to protect you, I feel like you will, in some capacity, get paid.
How can you
I
not
just
get
feel
paid?
like, how can you not get
You
paid?
just worked.
You know?
I mean, imagine coming to
At
work
that
and
point,
not
it's
getting
stealing then, or
paychecks.
something.
Yeah.
And it happens all the time in America. And so I don't know how this will go. But like, and I'm not saying that's what's going to happen here, but I don't know Insight's situation. Again, they will not comment.
Sure.
But if, let's say, Insight was in bigger trouble than we knew and ceased to exist or filed bankruptcy and all this was discharged, these things do happen. And yes, there are laws on the books, but this would not be a criminal thing. It's a civil thing. And if you've ever heard the expression, you can't squeeze blood from a stone. First of all, a lawsuit takes a very long time, often years, for reasons that make sense. I mean, the criminal docket has to take precedence because defendants have constitutional rights, and you have to prioritize that, and the civil cases always take longer. But also, let's say they win, and Insight says they don't have the money. Then that's another fight where you're going to have to, send somebody to try and collect? I mean, this is, the idea that they'll definitely be paid is not solid at all. Certainly you would hope that they would be, and I'm sure that, Insight hopes that they can pay them too. But I don't know how this plays out because I've never seen it go from bad to worse so quickly and without really any warning other than the coverage we've done that, hey, this situation's going to be rocky, let's keep an eye on it. But even knowing we needed to keep an eye on it, I know I've been surprised by the speed with which it went from people I've talked to in that hospital system who even off the record were very optimistic about Insight are not anymore.
And
they took over. Oh, I'm so sorry.
No, you're fine.
Oh
we both do that to each
No,
other.
it's
That's so
okay.
funny. No,
Go ahead.
Okay. When I spoke with Tom Connolly too, not even today, but just recently, one of the things that he said that really stuck with me, and I could almost hear his hope leaving his voice. Like it was absolutely awful. And when we report on this, it's almost like we're doing it every single day. So it's almost like we're in it with them too.
Right.
And it's a lot to see and to be a part of. When he was saying to me, I had, my nurses were out there and they were on the lines, they were kind of picketing a little bit, and then they were asking people to come in and to help them and to, pay for this hospital, to keep this hospital open. They begged people to keep this hospital open. Insight swooped in and saved the day. And now we are worse off than we ever were.
Right.
And that's how I was just like, I didn't even know how to respond to him. I just was just like, wow.
So on this topic, we've had lots of people reach out to us anonymously, and we will protect your anonymity. If you have any information about what's going on, or if you'd like to talk to us about your situation, you can reach out 330-744-8821, news@wfmj.com, watchdog@wfmj.com. You can reach out via Facebook Messenger. We're on Blue Sky. We will protect anonymity where it's necessary. We'll also give you a platform to speak out about what you're up against if you're ready to do so. We need your help as much as you need ours to tell this story, because when the officials are not telling the story, that doesn't mean there's not a story to be told, and we work for you, not for them. With that being said, for April, this has been the Outcue, and next month, we would hope that there is some update that is a little more cheerful than what we've had today, but in the meantime, we'll keep digging because you deserve that. This has been the Outcue.